Hello.
My head.
Good evening, good evening, good evening, good evening. Who do we have here? Who do we have here? Good evening. Welcome. Welcome. Hi, Phone Classic Souvenirs. Welcome. Thank you for joining. Welcome, welcome, welcome. So good to have you here. Welcome, welcome, welcome. Let's wait for a bit more. Good evening. Hope you had an amazing day. How was your day? Was it amazing? Hey, good evening. Why Shekzi? Good evening for me. Thank you for joining and welcome. So without further ado, I'll add Mrs. Toyin. Hi, good evening, Iron Fair. So today is question and answer day. This is the Feminine Health and Fibroid Support Community. We're dedicated to questions, making sure that women find answers to issues of life. Okay, so I'll just. You're welcome. I'm fine, thank you. I'm fine, thank you. Welcome. So, good evening, Miss
Hello.
Twain. Good evening.
Hi.
I can see you now. Can you see me?
Thank you. Yes, I can see you. Thank you, everyone, for joining. So, are you telling them a bit more about us and what we're about and what we're doing?
So this is Feminine Health and Fiber Support Hub, Support Network. What we do here is born out of the need to support women generally through feminine health issues and general wellness, then specifically fibroid, because we know that there are a lot of people who go through these and similar health conditions that don't find answers or don't have people to support them or people that they can speak with, apart from medical people. You just go to the hospital, boom, they tell you, look, you got fibroid, is this and is that, and you want to know if it's going to kill you in 3 weeks. Okay, but when you join this FHF hub, you would know, first of all, that's not going to kill you because it's not a death sentence, right? And then you also know that there are things you can do to alleviate the suffering, to alleviate the pain that you may feel. And that's why we are here. We are here to help you with those questions. We are here to support you. We are here to be like a family, because most of us have been through this. We've gone through the journey. We've had experiences, our own experiences, and the experience of other people. And we know that this is what we need to do at this time to help. So thank you so much.
Yeah, thank you.
I'll
Like
just
Mavi said, we're here to it's a support hub. We're here to just create an environment to help educate women, to create a support system so we can empower and nurture women. And honestly, I address some conscious and unconscious biases that we face as women, and also it's also a passion of mine to educate and inform the next generation, so they are better equipped to do the things that we didn't know and to be able to look after themselves better. So today's Q&A is with a gynecologist, and is going to help us answer some of the questions that the women from the hub have submitted. And this is something that we will do every Thursday or every other Thursday, just to create awareness and just help answer women's questions. So we have in here Dr. Segun Ilesomi. He's a consultant gynecologist. He's practicing in the UK. So Dr. Sheg, please introduce yourself.
Can you hear me?
Yeah.
loud and clear.
Hi, good evening. My name is Dr. Shagrin Letomi. I'm a consultant gynecologist and obstetrician here in the UK. And I've been in practice in obstetrics and gynecology in one way or another since 2002.
Wow.
Yeah. And my particular specialisms is in just general women health. I do quite a lot of obstetrics and do gynecology as well. I've previously worked in fertility, oncology, and in these days I do quite a lot of labor ward.
Oh,
Thank
wow.
you.
So you
Oh,
know
wow.
the drill. You're used to the feminine issues and all the things that we go through, huh? For 20 years. Wow. 20 years is a lot of time.
Thank you for coming today
Thank you.
again, Dr. Sheikh.
Yep, you're
We had
welcome.
Dr. Sheikh some time ago, and he's a very knowledgeable man. He knows his stuff, and it's good to know people like him as friends and as a consultant. Anyway,
Thank you.
quickly, some of the questions that we got this week from the ladies,
Yeah,
is mostly around reproduction and as well as fibroid stuff.
yeah,
So my
yeah.
first question, I'll read the first question. So it's around fibroids. It says,
Okay.
I know that some time ago we did talk about some of the myths and facts around fibroids. So maybe you want to shed a bit more light around that. So this lady wants to know if fibroids bleed, and she wants they says, what are the facts and myths? What are the myths and facts about fibroid? Can fibroids prevent fertility? I know we discussed it some time ago, but if you just kind of refresh us and tell us a bit more about the myths and facts
Okay.
about fibroids and if this prevents fertility.
Okay.
Thank you.
I think, thank you for the question. I think first things first is just to reassure that because a lot of women have fibroids, whether it's symptomatic, so whether it's causing them problems, or asymptomatic, not causing them any problems, women have fibroids. Like I said before on this forum, in some studies you can find up to 8 or 9 women in every 10 having some form of fibroids or the other.
Wow.
In terms of what causes the fibroids and whether you can do, whether you can see, for example, a 12-year-old girl and from there start doing specific things that ensures that they don't get fibroids. No, there is really no particular preventative measure for fibroids. So far, you have a uterus. The uterus it contains, well, it's made up of smooth muscle, and the smooth muscle can suddenly start to overgrow, and that is the fibroids. Thankfully, it's usually benign overgrowth, because if the overgrowth, for example, was occurring in other parts of your body, like your skin, your liver, chances are that it can very easily be a cancer.
Right.
In terms of how fibroids affect, just general everyday life,
Okay.
the commonest complaints associated with fibroids is menstrual changes. Menstrual changes in terms of people having heavy menstrual bleeding, prolonged bleeding. So this is when the bleeding is lasting for more than 8 days in every cycle. So people have different lengths of cycle, but it's when it's lasting longer than 8 days. Heavy bleeding is as described by the woman. So if the woman is describing any type of bleeding she's getting as heavy, we have to take that as that's heavy bleeding. It might be that it's soaking through pads. It might be the person is finding that on the heavy days, they are having to change pads or tampons quite frequently compared to maybe their colleagues or their friends or siblings. In terms of other symptoms, it can be pressure symptoms where the fibroid is so big, it's actually irritating organs that are just nearby
Right.
the uterus or nearby the womb. The bladder sits in front of the womb. There's the bowels or the intestines just start behind the womb. So if the pressure is such that it's pressing on the bladder, then you find The women are such that once they need to go for a week, they need to go for a week. They find they are passing small amounts each time, and they drink
Right.
a little bit, or they need a wee, and they just find that they just can't hold their wee for as long as some other women. It can press on the bowel and can cause difficulty opening your bowels. It can cause pressure sensation on the bowels that just makes you feel like you need to go, even when you've already gone.
Gone. Oh,
So
wow.
when you start having these sort of complaints of the heavy bleeding, pressure symptoms, that it actually stops the urine emptying from the kidneys into the bladder properly. In such a situation, you would find that those sort of women need surgery of some kind to deal with the fibroids.
Fibroid. Oh,
Fertility
wow.
issues can be dealt with fibroids, but particularly the fertility issues would be, you would need to investigate other reasons before blaming the fibroids. Many women across the world get pregnant, have babies, multiple pregnancies rather, with a fibroid in there. It's just there will be those women that actually their fertility issue is because of the fibroid, or the fertility clinic is asking that the fibroid be dealt with before they
Fun.
proceed with
Wow.
fertility treatment.
Awesome. Awesome stuff. Thank you for that. And I mean,
Was there
some of these things, some of these
anything I
things that.
left in that out in your question? I can't hear Tony.
Oh, really? Can you hear me now? Okay.
Can you hear?
Can you hear me, Mavi? Oh,
I can hear you loud and clear.
can you
Perhaps
hear?
Okay.
you
Can
may
you hear
want
me,
to check your
Shet?
connection because I can hear Miss Toyin loud and clear.
Can you hear me, Shet? Is it better now? Can you hear me now?
Yes, I can.
Ah, awesome, awesome. So I was just saying thank you for that, and some of those things that you highlighted actually do resonate. So with me because those were some of the experiences that I had. And quickly before I go to the next question from the platform, so this that you were talking about actually made me realize something. So is it a possibility, Dr. Sheds, that if you have as a young woman, if you have menstrual bleed for like 3 days, and then after maybe some years, then you see that it progresses to 5 days. Is that a sign? And then you find out that, oh, now it's no longer 5 days, it's 7 days, 8 days. Is that a sign of that you might have fibroids, something that you should be looking into?
Strictly speaking, on its own, just looking at a change in menstrual pattern on its own, it can be age dependent.
Right.
I might be dealing with like a 13-year-old girl who is describing what you're describing, and now I'm seeing the person at 16 years old. It would still be something different. It would be just all of the thing that just comes with starting one's periods and for the periods to become more regular. In that situation, you just check other things. It can be things ranging from like polycystic ovarian syndrome
Right.
through to endometriosis. It could be fibroids at that sort of youngish age. Now, if I exchange that with a woman that was probably about 48 and she suddenly started experiencing all of that, it is possible she's in what is known as the climacteric. So she's about to go through the menopause.
Right.
So there can be this phase between someone who is having regular periods and someone whose periods have totally stopped because they've gone through the menopause. The people's periods would usually just go slightly haywire towards that very end.
Right.
It can be a bit irregular. For some people, they are lucky they don't go through that for too long, while for some people, they can persist through that for up to 2 or 3 years. And by the time they cross into the menopause, everything just totally stops because they are no longer having bleeding. Then they are no longer thinking of their symptoms as anything worrisome. If it's somewhere much later on in the 60s, 70s, then all of that symptoms would be something that one would worry about, that it sounds like a type of cancer.
Right.
So it just depends on why the person is coming to you and just the general history surrounding that. Having said that, because fibroids can be associated with menorrhagia, so that's when people have heavy bleeding, prolonged bleeding, it is usually possible that you'll find your gynecologist is trying to rule out that there could be fibroid involved as they start to investigate what might be causing the sort of change in bleeding pattern.
Interesting. That's interesting to know, honestly. Thank you for that. Thank you for that.
No worries.
So the
So
second
does it
question.
mean?
Go on.
So I just want to ask, does it mean that if you see a symptom, then before you find out what it is, you have to know their age or something like that? Does it mean? And then secondly, if, like she said, if a 12-year-old or a 13-year-old comes up with this kind of complaint, will it be too early to start doing investigation for fibroid, the PCOS? And will it nip it at the bud? Because I know endometriosis and PCOS can be very, very stubborn and painful and, everything to treat. So would it be too early to start investigating for these conditions for the younger girl, 12 years, 13 years? Will it be too early?
So the first one is it's not going to be too early to try well, part of the investigation is also asking people questions. So you want to one would want to know history of that 12 or 13-year-old's period, how it started, is it regular already? Are they using contraceptive pills to help regularize the periods, which can happen sometimes in the very young, in the children that might already be having periods. The main thing is to ensure that if we follow the usual way doctors take care of patients, if someone comes to you with a problem, you want to take a history. So you want to know what is the story around what you're telling me.
Right.
You want to probably see what limited examination. So, checking the person's general state of health. Are they pale by looking in their mouth, that sort of thing. And then just listening out for other things and examining the patient. For the younger patients, it can be difficult to carry out like full examinations as you would for a more older woman. And then you just think of what limited investigations you need to do to just get an answer as to what is going on. Like I said, common things will occur commonly in certain age groups. So in that sort of earlier age group, 12, 13, 14-year-olds, it will be just problems related to them starting their periods. Their children, these days you would see that there would be different sort of, should I say, sizes of our children now. You will see the very slim child that parents will probably complain it's not eating much, and she will get almost up to age 16 before she even starts having periods. While you see some 10-year-olds that are quite chubby, that's because they've got lots more estrogen running through their bodies, and they might already start having periods. If the period comes and it's regular, that's good and fine. If it comes and it's painful, sometimes parents and the girl might want treatment for that. If the period comes and it's a bit irregular, heavy, bleeding, and you can't just make a head nor tail of it, and you can initially consider treating. And the commonest form of treatment is to offer the young girls the combined oral contraceptive pill. That just helps to regularize the period because it gives you a certain amount of hormones through an initial 21 day. And then there will be the 7-day where they're taking like iron tablets or nothing at all. And then they would have a bleed. And the younger girls are able to now plan for when to have their pads, their vulva pad, their sanitary towels ready, and just how to just be aware that they will still have a period. It usually helps to sort out menstrual pain as well, those early ones. It's very difficult to find endometriosis. Who knows? Because it develops right from when you were forming in your mom's tummy even. It is difficult to search for it. And even if you try to do anything to search for it, you start to worry how much damage the doctors themselves are causing for the future, for the fertility future of such a person, because it will involve surgery to see it, take a biopsy, and sometimes burn it off, for endometriosis particularly. And for fibroids, like I said, you can't really do much to prevent fibroids. You can just be aware of it and then manage symptoms around it.
Oh, wow.
So just to be aware. Nothing
Yeah.
more.
So,
Yeah.
so which also leads me to a question around
Yeah.
fibroids and the younger girls. So, at what point, knowing that okay, this all of fibroids increases around the hormones and how that works in the child, at what point will you start to consider to begin to maybe help a young child, you know, especially if there's a hereditary component, you know,
Mm.
with the child? At what age should you start to do something, you know, for the child?
You know, the main one ends up being education. It's like here in the UK, I will get the year wrong. I think I would say probably in the I would say late 90s maybe.
Mm-hmm.
There was a contestant on Big Brother UK
Right.
that ended up having cervical cancer, and just because of her
Ah,
profile
I remember
and
her
how
now.
people know Jade Goody.
Yes, that
Do
one.
you remember Jade
Jade
Goody?
Goody.
So we had something known as the Jade Goody effect on women wanting to take up their cervical screening
Mm-hmm.
here in the UK. And the thing would be education. So if, for example, if I paint a picture, if there was a patient of mine, maybe in her early 40s, for example, that has had problems with fibroids, had children, she would understandably be concerned that maybe her daughters might go through the same.
Mm-hmm.
And for that reason, she might hope that there's something she can pass on. Usually, the best message is to just make the younger girls and the younger women understand what symptoms they might be experiencing,
Mm-hmm.
helping them delineate what is normal from normal, which they themselves sometimes they would know
Okay.
when they are speaking to their friends, and then just helping direct them to where they can seek help. It's not unusual that once you've had an appointment with your GP
Mm-hmm.
here in the UK, you would usually use your general practitioner.
Mm-hmm.
I would say probably in Nigeria, you would get the chance to just go direct to a specialist most times. Once you have the chance to speak to a specialist, then they usually sort of allay any fears. If your periods are heavy compared to your sister or your friend, but you feel it's manageable, for example, it might be that you would say you require no extra additional input by the doctors. It is possible that you might be, I don't know, in military training or whatever, and you're not looking to have children for, I don't know, the next 5 years or whatever. And you might decide, you know what, I'll have the Marina coil inserted instead. And this is a intrauterine contraceptive device, sits in the womb for 5 years and does not need you taking it out. For some women, they just have probably tiny amounts of bleed when their periods should come. For some women, they have no bleed at all, but it still keeps the womb itself healthy. So there can be different forms or different ways to help. So far, people are informed. And it's always information, isn't it? Once people are informed about what they're experiencing, then they seek the best help.
I absolutely agree with you. Thank you for that, because honestly, it's just educating and informing the younger girl, you know, about
Mm,
what's normal and what's abnormal. And honestly, I would say for my own personal experience, that's something that I didn't get growing up, to know what's normal and what's not abnormal. So with heavy bleeding, I just thought, okay, maybe that's just normal. I'm just having excess, extra
mm,
than maybe everyone else. And so I was managing it. If I had awareness, if I was educated, if I was informed enough to say, oh, okay, you need to get this checked out. You might just not be normal.
mm,
You know, so I do
mm,
agree with
mm.
you completely. It's really the informing and educating them to know the difference, what's normal and what's a bit over the top, and then start to do something about it, get help.
When I was a teenager,
Mm-hmm.
there was this narrative that, you know, in my secondary school, it hasn't been very long. There was this narrative that, you know, that was being paraded around that if you're sexually active, you're not going to have heavy bleeding and you're not going to have pain and all
Mm,
of those.
mm,
And
mm,
so for girls that did want to be sexually active. So
mm.
you can't complain, right? It's your fault that you're having heavy bleeding. Is it
Yeah.
what would you medically say about this?
Well, first, it's totally incorrect. Never, 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 never. You don't have to be sexually active to have less painful periods or less heavy periods. So it's
But
just a non-starter. It's not. There's no biologic or scientific basis for it. Um, it's very difficult sometimes to even go down the route of trying to dispel when misconceptions occur because you don't even know in what context it started
That's,
for you to start trying to dispel it. It's just straight away. It's totally not true. And many different ranges of I've seen different ages that I've attended with painful periods. It is true that there will be this group of women that as soon as they have their baby, when their period restarts, it is no longer as problematic as it used to be. There'll be one sort of group of women. So it is possible that people just look to that small, tiny group of women to say, oh, maybe that's a cure for it. But you forget as well that there are millions of girls and
when
young women
when you
that
start
have
having
combined oral
clots in your
contraceptive
blood,
pills.
when you start
Mm,
having clots of blood in your
mm,
period, is that
mm.
indicative of fibroid?
No, it's just indicative of the heaviness
heaviness
of
of
that
the
bleeding.
Okay.
It's indicative of the heaviness of the bleeding. There's in that sort of situation, it is the sort of thing that might make someone speak to their doctor, and it is the sort of thing that the doctor might want to offer you a blood test to just make sure you're not becoming anemic. If it's making you anemic and you're not able to sort of keep your levels up with just diet or even some iron tablets, it might be the stage where you start to seriously consider using combined oral contraceptive pills to just help regularize that period,
Mm.
or indeed to consider a Mirena coil if it's appropriate.
On that
Wow.
seriously, on that aspect, that's probably going to be a conversation for another day that I will bring up. But there's also the withdrawal symptom or whatever they call it of that thing, and I had that serious migraine, but that's a topic for another day.
I
I'll go
understand.
quickly. I'll go quickly to
Okay.
one of the questions that we received. So, actually, because of our time, I'm going to quickly join this one together so that you can answer both at the same time. So, someone asked, they're 43 years old, and they wanted to know if at that age they should be worried about having fibroid. And the other one that I'm going to ask as well, and then you can answer both of the questions for us, is fibroid hereditary? Someone wanted to know.
Hmm. So is fibroid hereditary? We can start with that. Yeah, because so many women have fibroids, like I said, if you have a room that has, I don't know, nine girls in one classroom in, A class, for example, if 9 out of 10 of them have fibroids, they are not related, isn't it?
Yeah.
But if those 9 in 10 sat in, I don't know, in their sitting room with their sisters and cousins, and you counted another 9 in 10, it is very difficult to prove that it can be related. We still ask the question though. We ask, oh, did your mom have heavy periods, for example, just to try to fish to say, oh, mom had heavy periods. Did they find out why it was? Oh, they found fibroids. Oh, okay, who knows? Maybe now you're saying you've got difficulty passing, holding urine for a long time. You're telling me that you have heavy periods, comes with clots, and then I'm feeling through your tummy and I'm finding that there is a swelling there. Just easy Sherlock Holmes. You just think, it's fibroids most likely. So it will be that would be the way to look at it. In terms of the first question, which you asked about a 43-year-old just finding out that they have fibroids, um, it can be one of two things. The person has been in great health, has had all their children, and has not necessarily needed, should I say, in-depth investigating through their lives, especially if they've had children, maybe even if they had scans. I trained at a time when it was possible for a woman to just have just the one scan. You concentrate on what was happening with the baby and just leave everything else. It is possible then that they would only just find out now because they are getting some sort of heaviness to their bleeding, some sort of unwellness that is making them anemic, or it can be any sort of symptom that I've already been describing. that can mean they come through to see you. And once they've seen you and you have an ultrasound scan diagnosis that there is a fibroid, it can be worrisome to someone that never knew they had fibroids, for example. The thing going forward will be what symptoms are they getting now? Are they still planning to have any more children? And what sort of treatment are they hoping to get?
Right.
Because it can range from just using tablets to having the coil inserted to considering a small procedure that just helps to slightly distort or destroy the lining of the womb, or all the way till removing the fibroids if they were planning more children, and a hysterectomy, which is to remove the womb. So there can be different treatments available. So
Awesome.
it's not like these days it
What?
shouldn't be like a big thing, unfortunately.
Oh,
It can be in some parts of the world.
well, that's why we're here to create awareness, let people speak out that there's help, and it's not the end of your life, if you've got fibroids. But quickly,
Yeah.
that will bring me to a question quickly, actually, that's been on my mind. So,
Yeah.
for everyone listening, what is normal flow? What is normal and what's heavy? How do you know, okay, what I'm having is normal? What is the expectation of what a normal flow should be? Like in what measurement? Maybe in measurement or how do you quantify normal and heavy?
You know what? Amongst all of us just listening in here, if people typed their own thought of what was normal, you would see the different ranges. So if people wanted to, they can type it, and I'll keep scrolling through to see what their own answers are. If I just wait for, I don't know, 10 seconds to just see whether
Yeah.
people actually respond with
Absolutely.
answers.
So
Okay.
I'll start by saying 2 tablespoons. Is that normal?
2 tablespoons is a tablespoon is 10 mils, isn't it?
Yeah,
You know, when you
thereabout,
take
yeah.
your medicine, when you take or give children medicines, 10 mils is a tablespoon,
Yeah.
where a teaspoon will be 5 mils. 10 mils to 20 mils is what you're describing, isn't it?
Yes.
Yeah,
Is that
that's
normal?
normal. That's quite tiny.
Oh, okay.
That's quite tiny. And whilst it can be very difficult to quantify, I think you'll hear people talk about from 30 to 80 mils, or 30 to 80 mils can be a sort of like average value. But how do you know?
You
So
see,
it's so difficult.
in relation to that question, I used to feel that, I used to feel that my period wasn't normal at some point when I was struggling with fibroid. I used to feel that I had normal period until a roommate who would who who would just course through her menstrual period without any drama tell me, oh my gosh, my period is so heavy. I'm like, excuse me, don't even start. So what is heavy to one person might be light to another person.
Yeah,
So apparently, for me, where I stood, her period was just normal, nothing heavy about it. But she was complaining that her period was heavy because she had to change multiple times a day, and that's because you don't want to be irritated. That's why. So you can't
So
say
Well,
at what point? So is it an individual thing then? You look at what you started with and when the change in pattern occurs, because I'd just like to know at what point should people start to say, okay, this is not normal anymore, this is abnormal for me. I know it's an individual thing, but how much more are they bringing
at
out
what
that you
point.
now think, okay, this is not normal anymore, this is abnormal.
I'll just interrupt you just so that the thing is, like I said, I think a couple of times, you see, there was a time when you used to try to help someone interpret. So I don't know, Fumi might say, oh, you know what, it is, I soak through one pad on day 2. Day 1, it was just a few drops. Day 4, it was just a few drops, and it had stopped totally by day 5.
Yeah.
But I soaked through one pad on day 2, and for me, I want to interpret that as my periods are heavy. I have to take that. You see, now it is possible that the pad became just slightly heavier than a few drops, and that's the thing. I'm going to have to take that. So once you say it is heavy, I can check to see what your idea of heaviness is and what your hope for a treatment goal is. So if your treatment goal was, you know what, when I'm having my periods, when I have my 5 days, I just want to see a few drops, a drop today, a few drops tomorrow, 3 drops on the. If you're just looking for a few drops here and there, then it might be worthwhile just explaining that maybe that sort of person might be better served by having almost like no periods and having treatment that ensures no periods. It is possible you find someone who would say, oh, that day they just use a packet a day
Right.
through their 5 days period, and that is quite a lot. And they would say, oh, that's still fine. That there are some of the days that they just sit on the toilet and they just let the bleeding just go out rather than just keep wanting to change. And that on those days they don't go out. On those 2 days they might not go out of the house at all. They'll just be indoors. Now you hear those kind of things, especially if the person is now having anemia or having symptoms. You have to start considering that you have to help the person say, I think that I have to call that heavy. And sometimes it's just the stories around use of sanitary products,
Right.
able to leave the house, able to go to work.
Okay.
Those are the things that now buttress the fact that it is actually heavy. But like I said, the woman decides what is heavy, and it's supposed to be the best way to deal with it. Someone shouldn't be telling you that, "Ah, that's not heavy enough, that's not heavy enough." Because if you meet, for example, a female gynecologist who is like you're describing, your roommate was, is someone that uses a packet of sanitary products over a 3 month, 6 month period, while you're used to using that packet for just the one cycle. It can be difficult to convince that person that that is heavy.
Heavy.
Do you see my meaning?
Got you.
Wow.
Got you.
Okay.
Got you.
So
Got you.
I'll just ask a question that someone, wanted to ask, which is slightly different from the fiber question. To say, is it possible
Okay.
to have a closed cervix or
Mm-hmm.
stenosis when you
Mm-hmm.
still menstruate regularly? Can this lead to secondary infertility? And if yes,
Mm.
what can be used to rectify it so that it doesn't lead to infertility?
Mm. You know that thing I said that usually when you hear sort of this kind of questions, I always just say, oh, the best way is to see the person, to speak to the person, to be able to hear, know things that can be as on. It might seem a little bit not so necessary, but things as important as how old, any previous children, for example, because the person talked about fertility. Could the person understand maybe why they develop this cervical stenosis? The cervical stenosis, actually, what that means is normally the orifice that leads, that's from when you pass the vagina, you get to the cervix. The cervix is the beginning of the womb itself. Now, that small canal there of the cervix, it should allow you to admit probably like a very thin straw. There are some women that you just try as you may, you just can't put even a thin straw through, and it is narrow for you to gain access in. But you know how water is. You've had, I don't know, you've had bowls or you've had buckets, for example, that has a tiny leak. You can't really see the leak. But if you came back 5 hours later, you would see that the full bucket of water
Okay.
has already
Okay.
drained out or has already leaked to halfway. So liquid will find its way out, so that's why stuff can come out. In terms of being able to insert, a device by the doctor or something, it might be harder to achieve that, and it can be treated depending on the cause. So there could be causes that range from like some sort of uh, should I say congenital malformations, that's from when the person was born, all through to someone has had children before, had problems during the childbirth that involved, a lot of repair work, or the person has had procedures through probably maybe they've had something known as DNC. They used to call it those previously
Abortion.
dilatation and curettage. So they've had a termination of pregnancy, or they've had treatment for incomplete miscarriage, and it's probably been done, and there's been trauma to the area. It can be an infection even. The commonest sort of infections that would cause that kind of stenosis would need to be so bad, sit in the vagina. Otherwise, the chlamydia, for example, actually affects the tubes rather than the neck of the womb. So yeah, there can be different causes. And in terms of treatment, it's just to identify how old the person is, what exactly you're trying to gain access into the womb for. Is it because it is so blocked that menstrual blood does not flow out of the womb, and that can cause its own type of pain, and you're just trying to gain access? The woman would usually be asleep, and then you just try to use thin plastic tubes to try to gain your access in, and just being careful not to cause any damage. And if you're able to achieve that, you would need to just find a good way to ensure it doesn't close back quickly.
That sounds
But
painful.
that will be the sort of thing. It can be painful. It's just it's usually done with the person asleep, and for the ones where it is just in general, when you're seeing your general doctor and they can't see it, it can just be that you just need a gynecologist using other instruments to be able to just trace their way in. And once it's open, it just lets anything collecting in there come out.
Right.
So people can still fall pregnant, and they don't need the neck of the womb to be wide open to fall pregnant because liquid can still flow
Flow in and
up.
out. Awesome.
It's really unusual for you to find that that is actually the only cause of infertility. It might be as a result of other things as well.
Thank you very much for that. So
Interesting.
I'll just go right
You're
to the
welcome.
next question. What can be used to bring high prolactin to normal level if
Okay.
if bromocriptine has not been effective?
Today we're
There,
really
there,
high tech
there's a few.
technologies.
There's a few ranges of drugs. It's bromocriptine and then high prolactin. The prolactin, you sort of need, well, you need the prolactin in the course of breastfeeding, and you need prolactin for other causes, other uses as well. So for some women, it can be so high that it can be causing hormonal imbalances that just prevents them falling pregnant. Just because once it's high, I don't want to go into the specific science of it. It's just hormones are released, hormone signals are released from the brain, the hypothalamus, and when it is released,
Today we're
when
in the
it is
science
released,
class.
when it is released to something known as the pituitary gland, it can release some of. So anyway, the posterior pituitary. But when it releases these hormones, it can also affect some of the other hormones like follicle stimulating hormone. And if the follicle stimulating hormone is, for example, very high, then it means the person it starts to seem to the body or to so the body system starts to feel like, oh, have I gone through the menopause if this follicle stimulating hormone is so high? So that can be one way they struggle with fertility. Because the hyperprolactinemia can also be because there is now a swelling or a tumor of that pituitary gland. It's an important finding, and such people will need to have like a CT of their head or a skull X-ray even to just make sure that there's nothing more serious happening. I know the person might be worrying about fertility, but you hear something like that, you should check to just make sure there's nothing more serious causing that hyperprolactinemia.
Right.
Having said that, the way to treat it is usually the same thing, dependent on is the person symptomatic. If the person is having spontaneous lactation, that can be quite embarrassing because of how it will stain clothes
Oh
and
wow.
things. It's not like you're breastfeeding. So for that reason, that might be a reason for treatment. Bromocriptine is one of those early drugs that people use, can have some side effects, might not work as well. Some people use other things like cabergoline as well. So there are other drugs, there are other newer drugs that people can use to treat it. Like I said, most times when people have certain symptoms, certain conditions, especially in gynecology, you usually want to know, so what's my treatment goal? If the person is trying to fall pregnant, then it's always good to just look at the person as a whole. So you want to check, don't focus only on the hyperprolactinemia. You want to make sure that the person is, for example, having unprotected sexual intercourse as you prescribe it, or not prescribe it, as you should normally to try to fall pregnant. that the person has regular periods. You want to make sure the person is of a good, healthy weight, or at least they are doing something to stay active. So you want to know lots of other things other than just focusing on, oh, if I correct the prolactin, all will be well.
Hmm. So what you're
Mm,
saying in essence is when you're treating some of these things, you shouldn't take
mm,
it as a part of it. You should take it as a part of a whole, not just as
yes.
the
It's not
whole.
usually
Mm,
isolated.
Yeah, so that it doesn't you
mm.
don't treat one, you don't treat it and upset something else.
Mm.
Hmm.
Well, more like you just don't focus on something that might not actually be the answer.
Hmm.
I know these days you can do investigations and find certain things out, but one needs to remember that, be it fibroids, be it hyperprolactinemia, many women have gotten pregnant with several different conditions that your textbook, for example, will tell you that, oh, they find it difficult to fall pregnant. I've seen a lot of women that are falling pregnant, even though they have polycystic ovarian syndrome, without necessarily doing anything in particular per se to help them fall pregnant. So they don't, for example, all need IVF, for example. That's my meaning. So people can just still fall pregnant. So it's important to know that there's always this continuum, and people can just fall somewhere there. Some people are
I
lucky enough that, in spite of what they've got, they are still able to surmount their problem without needing too much intervention.
Mm.
hmm. I
Amazing.
had a
Amazing.
friend who had a child that she waited for about 5 years after her
Mm,
marriage before she had her first child, and they did all kinds of investigation, and at the end of the
mm,
day the doctor said there was no reason why she couldn't have a baby. So
mm,
I don't know. Eventually, after 5 years, she had the first child, and
mm,
since then she hasn't been able to have another one. Could it
mm.
be, is there something medically responsible for that?
Well, they've got a diagnosis for it. They call it unexplained infertility.
Yeah, that's what she was told.
Mm.
That's
So,
what she was
so,
told.
so, so that's unfortunately that's what it is. So it's unexplained. We can't explain why, and many people have different stories as to why. Indeed, I think in two articles now, and
Mm.
one or two things that we're seeing, the same way your friend just 5 years later, she suddenly fell pregnant. Um, I've seen a couple of stories now, and one close to us, one in our hospital, where someone fell pregnant only after trying for 8 years, and everything seemed fine, but the person fell pregnant after they had had COVID. So
I'm sorry, they had COVID.
after they had had COVID, so COVID has only been with us since just only recently.
Oh
It
dear.
cannot be a type of cure for infertility. So, but the person strongly feels that way, like, ooh, it was when I had COVID and my period
I got
afterwards,
pregnant.
I got pregnant.
Oh wow.
So,
Wow.
people can link in different things when unexplained infertility suddenly leads to them having a spontaneous conception. And there are quite a number of women with unexplained infertility who try IVF and they get pregnant very quickly as well with the IVF. So don't
It's
sit in
Wow.
silence. Go speak
interesting.
to your doctor.
I think we may have to
Yeah.
round up at this point
Mm,
because of time.
Absolutely. Thank you so much, Dr. Shakes. We're grateful that you're able to come. We know that you'll be back again.
you're welcome.
But
I've thoroughly enjoyed this session. I wish we could go on, but Instagram will not allow us to go beyond
yeah,
59
before.
minutes.
But I
Okay.
mean, honestly, like our goal is just to create the environment to educate people. And earlier on, you said to ask people to post, what they think normal is and heavy is. These are
Mm,
Flow.
some of the things that
Mm.
we're struggling with as a culture. People are not that way inclined. They don't think they want to share those kind of things. They think it's private,
mm,
it's personal. But the
mm,
truth is, honestly, this is the only way we can learn, by speaking up, by sharing your experiences, sharing your journey, and someone else can glean from it. Someone is learning from what the other person is saying. We have to
mhm,
come out of this, I don't know, I call it cultural thing. that just hold us back. Honestly, if this
Our
was a white
shush
Caucasian,
mentality. We've been trained to shush up.
if it was a white Caucasian prominent thing, it would be all over the place. But because as Black people, as Africans, you know, African Americans even, we're like, we don't talk about these things. We need to share. We need to talk more. We need to, you know, speak up. And that's how we get educated. That's how we get the knowledge. That's how we can support each other and help the other woman. The other woman is helping the other woman, holding the other woman's hand. Thank you so much, Dr. Shex, for coming again today. We're grateful. But quickly, we're going to talk about, we have a launch in exactly 1 week, next Saturday after the 18th of September. And we just wanted to let people know that please register. We'll put the link there for you to be able to register to the official launch of this FHF support network. And like I said, we're just trying to create an environment to educate women, to support each other, empower and nurture ourselves, you know, and just address some of the biases, you know, both conscious and unconscious ones that we have, that we've been brought up with, that has been put there, some of them cultural, some of them religious, you know, and it's just time for women to help each other, to just, you know, before this video, I was in someone else's live video, and it was all about women wanting to empower the other women because they're sharing their journey, they're sharing their story. And honestly, that's the only way we can learn. That's the only way, belonging to a community, getting, you know, no one can do anything by themselves. We all need each other to come together, support each other, and also, you know, just share our journey, share the information. You never know who is going to help. You know, I got help, I got support system. Well, not so much support system, but I got some kind of reassurance only because someone shared their journey in a video. I listened to, and I was like, okay, if she was fine, she came through it, I can do it too. I will be fine. You know, this is not going to be the end of it. So honestly, we just need to speak up. We need to share more, you know, and there's nothing to be ashamed of. Honestly, there's nothing. Every other woman is going through it, so I don't know why there's no shaming in this. So
there's no shame.
Our launch is on the 18th. You know, we have amazing speakers. So Dr. Shex is going to be there. Have you registered, Dr. Shex? Have you registered?
I don't know.
Sorry, I put you on the spot there. But honestly, honestly,
I'll check my schedule.
Yes, please register. The launch is on the 18th of September, Saturday, the 18th of September, and it's 11 a.m. to 1:30 p.m. It's going to be a lot of fun. Come join us, come support us. It's an official launch, you know, and we have great speakers, people who know their stuff too, like Dr. Shex. You know, they're going to be helping us around lifestyle, you know, around alternative medicine. And also we have a celebrity advocate who's going to be joining us as well. She's going to be sharing her story, honestly, and that's how we're going to help each other, supporting each other. The other woman sharing her story. She shared her story, I learned from it. Someone else is sharing their story, you're learning from it. And every day with this Q&A, honestly, I'm learning new stuff. Today I've learned a few things, you know, around fibroids, around I have a young growing daughter, how to help my daughter, how to keep her informed, making sure she knows what's normal and what's not normal.
What's not normal.
So honestly, we need to just keep doing it. Education,
keep doing what you're doing.
Informing.
Thank you.
Thank you so much for your time today. Really appreciate you.
Thank you too.
Thank you. God bless.
Thank you. All right. You too.
All right. Thank you, everyone.
Bye,
Thanks
everybody.
for joining. We appreciate your time. Thank you. And see you again on Saturday next week on the 18th.
Yes, please register.
Bye.
We put the link in there. Thank you, everyone. Have a good evening.
Yeah.
Bye-bye.
Bye. Bye. Have a good evening. Thank you. Bye. Bye.
Bye.